A 45-year-old male patient presented with multiple asymptomatic light-colored lesions over upper back and sternum since 6 months. Patient is known case of pulmonary tuberculosis and an ATT since 1 month. On examination, multiple hypopigmented macules and patches with clear-cut borders. Woods lamp examination reveals yellow-green fluorescence. KOH reveals spaghetti and meatball appearance. Pick the incorrect statement. First, we should identify what the clinical scenario will say. The diagnosis: pityriasis versicolor. Yes. Why? Point number 1. Multiple asymptomatic light-colored lesions. Yes, all pityriasis versicolor cases are asymptomatic skin condition. Number 2. Upper back and sternum. Yes, pityriasis versicolor mainly seen over seborrheic areas such as upper back and sternum. 3. Pulmonary tuberculosis. It indicates immunosuppressed state. Yes, pityriasis versicolor is caused by Malassezia organisms, which is constituent of normal human skin flora, and it is in yeast form. In immunosuppressive state, it is converted into mycelial form and it produces skin lesions. Number 4. Hypopigmented macules and patches with clear-cut borders. Yes, all pityriasis versicolor cases will have clear-cut borders, that is pencil tip borders. Then added up points are Woods lamp examination, yellow-green fluorescence due to release of pityriolactone from Malassezia organisms, KOH, spaghetti and meatball appearance. So it is a confirmed case of pityriasis versicolor. Pick the incorrect statement. Malassezia furfur is common organism. True or false? False. Malassezia globosa is common organism. Azelaic acid produced by Malassezia inhibit tyrosinase is responsible for hypopigmentation. Yes. Abnormally packed melanosomes causes hypopigmentation. Yes. Direct toxic effect on melanocytes causes hypopigmentation. Yes. We'll have a short discussion about pityriasis versicolor, then you can easily understand. So, pityriasis versicolor is a common superficial fungal infection and it is restricted to stratum corneum. Pityriasis versicolor, there is absence of inflammation. Why? Point number 1, stratum corneum is a state which contains dead keratinocytes and it is an avascular zone. Number 2, pityria rubin released by Malassezia organisms is responsible for absence of inflammation. Then the most common organism is Malassezia globosa. Globe, common. Remember like that, Malassezia globosa. And the mnemonic for remembering the organisms is GROSS. GROSS. G stands for globosa or for restricta, obtusa, sloofia and sympodialis. Two types of pityriasis versicolor, achromic and chromic. The first clinical picture is achromic pityriasis versicolor, in which hypopigmented macules and patches with clear-cut borders. The second picture is chromic condition, in which large hyperpigmented patch extends from lateral wall of chest to arms, which also involves axilla. Then, if you see pityriasis versicolor lesions, you are able to see fine briny scales. If it's not seen, on gentle scraping the lesion, you are able to see briny scales. The sign is called as Koncpt angle sign or Besnius sign. What are the theories put forward for hypopigmentation? Azelaic acid inhibits tyrosinase, thereby decreases melanin size and it produces hypopigmentation. Malassezia produce indole pigments which produce hypopigmentation and sunscreen effect. Abnormally packed melanosomes, abnormal structure of melanosomes, direct toxic effect on melanocytes and increased space between melanocytes and keratinocytes. Two things you should not forget regarding hypopigmentation. One is azelaic acid, another one is indole pigments. Then theories for hyperpigmentation. Large melanosomes to more microorganisms leads to more inflammation, which ultimately stimulate your melanocytes to produce pigmentation. Yes. What are all the points to be remembered in pityriasis versicolor? It is restricted only to stratum corneum. Absence of inflammation. Point number 1, stratum corneum, avascular zone. Number 2, pityria rubin. Commonest organism, Malassezia globosa. Two types, achromic and chromic. Koncpt angle sign or Besnius sign. 2 points for hypopigmentation, azelaic acid, then indole pigments. Two substances you should not forget. One is Pteridolactone responsible for yellow-green fluorescence, then pteridorubin absence of inflammation. Right.